When I think about people-centered care, I think about being part of that team with healthcare providers and making decisions about my healthcare, and having that voice where I offer opinions and insights about what's best for me. A voice that is valued and a voice that is considered important. And I think that when we work as a team, when we work collaboratively, we provide the best care for patients, and in doing so, it makes patients feel safe.
Knowing when I'm sitting or standing in front of a healthcare worker or provider that they're listening to me, that they show that I'm a partner, I'm there with an issue and there to help me. But along with that, what I'd like to see when I go to a healthcare place is more a combination of curing and caring. I don't want to be a transaction. I want to have a relationship with the person that I'm talking with. I want them to know who I am, and I want to know who they are. And that's the caring part. And once that occurs, I feel comfortable, I can share, I'm open, and hopefully the curing will come.
For people in their 70s, like me, making sure we understand how to deal with our medical situations is how patient safety can be assured. We are all on the same team. Let's work together.
Feeling safe in the healthcare system is of utmost importance. It involves competency, proficiency, cleanliness, privacy, and confidentiality, to name just a few. However, true feelings of safety come from compassion and caring. This begins with the very first interaction with a healthcare provider. That smile or pleasantness from the very first frontline employee goes a long way to instill a feeling of safety. And the compassion and caring must be continued in every interaction within the system.
My experience with the healthcare system is, unfortunately, I've had many, and they've been varied. And that's both as a patient and as a caregiver. So I feel like I can use these actual experiences to provide a valuable contribution and to provide a voice that can help make some decisions in the benefit of patients.
Patient advisors play a critical role in encouraging patients to actively participate in their own care. By sharing their stories, patient advisors underscore the importance of adhering to treatment plans, following safety guidelines, and promptly reporting any concerns.
Well, our main goal as patient advisors is to improve patient care, and a very important part of that patient care is patient safety. We get the opportunity when we work with different committees and different groups to share our experience either as a patient or a family member of a patient, and through that we offer a unique perspective, and we get to share information with healthcare providers about ways that they can improve their provision of healthcare, but also just give them some insight about how things look from a patient perspective. When we improve patient care, we improve patient safety. When we make patients feel that they are the center of their care, that they have a voice, then we have improved patient care and patient safety.
Who would think that as a patient we would become an important member in creating a safe environment for patients and families to heal and grow, to find new ways and ignite old ways to reduce harm. Yet here we are. And as they say, nothing for us without us. And as patient advisors, we are very much part of the growth of patient safety in our province, and we intend to stay here.
I think it's very important, first and foremost, to be open and honest and transparent. And then once that's established, then I, as a patient or a patient experience advisor or whatever I am, in front of somebody who is in healthcare, I think that's uppermost in safety, in promoting safety.
Having a family involved, having patient advisors involved in how we improve healthcare is essential. They offer a different voice at the table. They see the perspective of their family member as a patient or themselves as the caregiver, and they know their family member. I think having them involved, having given them a space to speak and to voice their concern or what they see as areas of improvement or areas of success is vital for us to improve healthcare moving into the future. I also think that their involvement aligns us with being open and transparent and ensuring that we're all there to provide the best care possible.
We have increasing healthcare costs, increasing rates of chronic disease, and an aging population in our healthcare system. We need to be more proactive and creative to respond to the health needs of our population. Partnering with clients and families shows respect. It values their insights and experience and empowers them to take an active role in their own care.
So we tend to believe as professionals with experience that we already know the potential issues and we think that we know their solutions. But instead, I do get surprised every single time that I partner with patient advisors because there's always something that we don't consider because they are looking from a different perspective, and I find it's always insightful. I don't think it's enough to put ourselves in their shoes anymore.
It is imperative to involve families in the care of the clients as much as possible. We consider long-term care their second home. Because of that, we want to ensure that we are creating a family-friendly atmosphere.
Engaging with patient advisors, you're seeing it from the lens of people who actually use the system, and that's crucial for us in making a system that's more accessible, more transparent, and really designed around the user instead of designed around the deliverer. When you look at it from a safety lens, it really comes down to simply being willing to listen, being willing to give patients and their families an opportunity to be heard, and giving them a chance to offer feedback in a true collaboration delivery, and the outcomes for their healthcare will improve.
My thoughts around older adult care and patient safety is that we can't make decisions without engaging the people the decisions are being made for. What we really need to do is ensure that we are asking older adults how we can best help them and use their lens in our decision-making process.
Listening to the aging population, we know what's happening. We know what we want. And healthcare providers listening to us, partnering with us, asking us what we want and how they can help us by communicating with us, by sharing knowledge with us, by giving us the information we need.
The aging population have a voice. They are capable individuals who have say in their care. And if they are in a situation where they don't have a voice, then that family member needs to speak for them. The elderly population deserve the same respect, the due diligence of care in hospitals as every individual. And I think once we reframe how we think about the aging process and include our elderly people as a very important part of our society and healthcare, then these patients will feel safer, for sure.
Having the appropriate assistance is so important when you're dealing with health issues, and it would be very beneficial to have an advocate in the system to help people navigate through the kinds of challenges they have to face. Such challenges exist for everyone, but they're especially there for an aging population, and I think we need to make sure that we do what we need to do to lessen the impact wherever possible.